Today, we're going to unpack the differences between OCD, obsessive compulsive disorder, and anxiety disorders. These are two mental health issues that are often overlap, and oftentimes people confuse one for the other. My name is Dr. Phil Sarpon. I'm a clinical psychologist, and in this channel, we dedicate all things to psychology, wellness, and graduate school. Today, let's start with talking about anxiety. Now, first of all, anxiety is a normal response. It could be stress, worry, fear, nervousness. It could be chronic. It could be intense. It could include symptoms like restlessness, irritability, muscle tension, rapid heartbeat, or excessive worry. It's usually future-oriented. In other words, there are future things that people are thinking about that make them anxious. OCD, which stands for obsessive compulsive disorder, is characterized by obsessions. These are intrusive, unwanted thoughts or images that also then lead to compulsions or repetitive behaviors or mental rituals to reduce the stress. Now, this could be an obsession of a fear of contamination, maybe not touching certain substances in the kitchen because you think it could actually contaminate you. So excessive hand washing, checking, counting, repeating certain phrases. Oftentimes I see things like obsessive compulsive disorders for spiritual behaviors. So constantly having to pray for different things in order to feel good or feel safe and to feel healthy. So as anxiety is focused on worry and is more broad and future oriented, obsessive compulsive disorder is more specific and intrusive. Now, one of the things about anxiety disorders is that we know that from a cognitive perspective, it's important to understand where these thoughts and these worries and catastrophizing and ruminating is coming from, to question those thoughts, to find evidence for or against those thoughts, to see if we can break down those thoughts to impact our feelings and our emotions and our behavior. While OCD, there's something called the ERP, which is the gold standard for OCD, where we have to focus on facing those fears without performing those compulsions. So that means whenever we have those intrusive thoughts and you want to pray and you want to wash your hands and you want to engage in the compulsive behavior, we try to help you to not do those things. And then not doing those things actually helps your brain understand that you haven't died. That usually when you do those compulsive behaviors is because there's a feeling and a fear that you'll die if you don't do those compulsive behaviors. And so when you restrict and you withhold from doing those behaviors and you find that that you're actually okay and that you're alive and that you're doing okay, it reinforces the behaviors that these compulsive behaviors are not actually true. That these are mechanisms in which your brain has told you, lies or deceptive tactics that your brain has told you in order to deceivingly attempt to protect you from something that actually isn't dangerous. Now, of course, it's important to seek out a mental health professional that can help you engage in healthy ways to not engage in compulsive behaviors and to question those anxious thoughts and belief systems, because we know that these things can be incredibly debilitating to one's life. But I wanted to do a quick educational video on the differences between OCD and anxiety, because I have often find that a lot of my patients and clients are misinterpreting or actually confusing those terms with one another. And so hopefully this video kind of clears that up for you all as well. If you have not already, please like and share this video. You can please subscribe to the channel, and hopefully with that, I will see you all in the next video.